don't know me, I work for the Center for Social Entrepreneurship, and I'm very excited today to bring Jocelyn Wyatt. So before we launch into that, let me just say a little bit about the CSE and what we do, in case you are not super familiar. But the Friday Speaker Series is something that's been going on for a while now and will continue to go on throughout the semester, and we're very proud of it. It brings a lot of wonderful insights and perspectives from the community, and we're thrilled to have wonderful people throughout this year. All talks will be here in Accent 219 at 1:30, so be on the lookout. Sorry, 12:30. So John Isham, who's not here right now, Heather and Mustafa are staff members that you can continue to reach out to in the future if you don't know them yet through the CSE and through variety of programs. Let me just say briefly about the stuff that's coming up for the CSE and for related programs so that you are aware for the upcoming week. The Davis Peach Project grant competition info session is happening on October 2nd at 4:30 p.m. in Davis Library 201. So and then next week's speaker is Alexander Hart from Madeira Global, which is an impact investment firm. So you'll get some emails about that you can look at as well. Also the TEDx student speaker competition. So I'm actually not going to be introducing our speaker today, but I will introduce Tiffany Sargent from Center for Community Engagement. Thank you so much for bringing our wonderful speaker today. I really appreciate it. So I'll turn things over to you.
Thank you, Nick. And it's just such a joy today to see all of you and to share an incredible resource that we have here at Middlebury. We're so fortunate to have Jocelyn Wyatt, the co-lead and executive director of IDEO.org, a true leader in work on purpose, which is something we're talking about on campus here, and living a life of meaning and impact, which is something we're all trying to support in our programs here at Middlebury. Jocelyn's work focuses on identifying nonprofit and social enterprises with whom to partner and designing innovative solutions related to water and sanitation, agriculture, energy, health, financial services, and early childhood education. Jocelyn specializes in building social enterprises and advising businesses in the developing world where she uses the market to affect social change. Jocelyn oversees IDEO.org's business development, fundraising, and operations, and works to spread IDEO.org's learnings through the social sector. She helped co-found IDEO.org about 3 years ago. And just a word about IDEO for anyone who doesn't already know, taking from some of their words, doing remarkable work combating the effects of poverty around the globe. And on their website they say, at IDEO.org, we believe that the most potent weapon against global poverty is design. The solutions, systems, and social innovation that arise from truly understanding and designing alongside the poor are the most likely to offer hope and improve lives. And for us, if we can't see real impact, we haven't done our jobs. And I hope that that's also a motto that we all can incorporate. Prior to joining IDEO in 2007, Jocelyn worked in Kenya as an Acumen Fund Fellow with an agro-pharmaceutical company involved in the production of malaria treatments. She served as VisionSpring's interim country director in India, where she helped increase the distribution of low-cost reading glasses to the urban and rural poor. She also did training, project management, and business development for Chemonics International, a contractor for USAID. Jocelyn received an MBA from Thunderbird School of Global Management in Glendale, Arizona, and a bachelor's degree in anthropology from Grinnell College in Iowa. While working as an Acumen Fellow, Jocelyn met and worked with Jacqueline Novgratz, many of you will remember that Jacqueline and Bill Drayton from Ashoka were the inaugural keynote speakers and award recipients at the very first CSE Forum in 2012. And in doing some research, just looking at some more information about Jocelyn, I found a quote from Jacqueline where she says, "It's been thrilling to watch her," Jocelyn, "go from being a fellow at Acumen to being a partner in a true sense, working to co-found and develop IDEO.org." And now, having Jocelyn here at Middlebury, I just want to share that Jocelyn actually has deep roots here with Middlebury. Her mom went to Middlebury, her grandmother went to Middlebury, her uncle was a professor at Middlebury. And then on a very personal note, I lived with Jocelyn and her family when Jocelyn was about this big. And we were living in South Hadley, and Jocelyn's dad was working, come on in, at Mount Holyoke as well. And when she was just a little girl then, the oldest of three, full of energy and inquiry, with parents dedicated to education and understanding critical concerns like finance and global issues, you can see the path that Jocelyn has taken. We had great fun looking at some old photos and reminiscing together. So in using Jacqueline's words, you can imagine my thrill in introducing Jocelyn today and bringing her to Middlebury. So thank you, and help me bring a warm welcome to Jocelyn.
Pictures. We decided to not include them in the presentation, but maybe next time. And we have until 1:30, is that? Okay, great. So I'm going to give you guys a quick introduction to IDEO.org, to human-centered design, and share a few of the projects that we've been working on recently. And I'll make sure that I end with plenty of time for you guys to ask me questions. So you heard Tiffany shared a bit about my bio, and as she mentioned, my background was really in international development and social enterprise. And I joined IDEO about 7 years ago to lead our social innovation work, and then started IDEO.org, where now served as our co-lead and executive director for about the last 3 years. So IDEO.org came from IDEO, which is an innovation and design firm that started about 35 years ago. IDEO was really a combination of engineers in Silicon Valley who came out of Stanford, coming together with industrial designers who were really sort of focused on form and beauty coming out of the UK. And so really our ethos is kind of that combination of form and function of engineering and design. And so in IDEO's history, really started as a product design firm. And so that meant that we worked on things like the first laptop computer, the Palm 5, the first mouse for Apple, and the first mouse for Microsoft. Really sort of many early technology products. We also did things like the Neat Squeeze toothpaste tube, and the Swiffer, and a whole range of products for Muji and others. And what IDEO realized over time was that what they had was not just an ability to design beautiful products that people could hold in their hands, but really a way of solving problems, a way of understanding people's needs, and really developing solutions to meet those needs. And so that was this process of human-centered design, which was something that IDEO really pioneered, and now many others around the world are doing as well. So this is just sort of a quick smattering of a range of products that IDEO has designed over the years, but again, what we've been able to do is apply this process of human-centered design beyond products to services, things like Bank of America's Keep the Change program, or the way that nurses interact with patients and run the hospitals at Kaiser Permanente. We do work with the government and with the social sector. We work on financial services, with hotels, with retail establishments, really with a whole range of different types of companies and organizations. So a few years ago, when I started at IDEO about 7 years ago, we really started to see the potential for what human-centered design could bring to the social sector. And so decided to create a separate nonprofit organization called IDEO.org, which would really focus on applying human-centered design to challenges related to poverty alleviation and work with nonprofits, foundations, and social enterprises on the same kind of approach and way of thinking that IDEO does, but really specifically focus on improving the lives of the poor, both in the US and internationally. So we have a team, this picture is a bit old now, but our team is about 30 people now. We're all based in San Francisco. About 20 of them are full-time, and about 10 of them are fellows and interns, and folks that join us for a project or a few weeks at a time to sort of fill various roles. Our team members come from a wide variety of backgrounds. Some of them are trained designers. They've been to design school and have studied industrial design or interaction design or graphic design. Some of them come from backgrounds in the social sector, in global health or in agriculture. Others have gone to business school. Others are researchers, social science or qualitative researchers. We have a couple of lawyers on our team now who decided to leave that profession and join us instead. So really a pretty wide range of interesting experiences that people come to us with. Sorry, some of these slides may be too hard to see in the back, but I'll talk you through them. So when we think about our impact at IDEO.org, it's really twofold what we're trying to do. One is that we're trying to create new solutions that improve the lives of the poor, and I'll give some examples of these. This could be anything from a sanitation business that allows people access to toilets in their homes, or it could be a water delivery service that brings clean drinking water to people's doorsteps. The second piece of what we're doing is we're trying to transform people and organizations through teaching them human-centered design. And so we do that, again, in a number of ways, which I think actually the Middlebury community has a far better grasp of than even many of my colleagues at IDEO. So I'll share this with you, but it sounds like many of you are very familiar with all of these things that we do already. But really we believe that through both working directly with nonprofits to bring new solutions to market, as well as working with the sector broadly to really spread and teach human-centered design, we're going to have the greatest impact on the way the social sector tackles challenges and ultimately works to alleviate poverty. We've been working now for about 3 years and have done about 45 projects at IDEO.org during that time. We've seen many of them come to pilot, and just a couple examples. We have about 3,500 people that now have access to their first toilet in their homes. We have about 3,400 people that now have access to clean drinking water on a daily basis. And I'll sort of talk through these as we go through some of the projects. In terms of the tools that we've developed to spread and teach human-centered design, we're reaching now about 200,000 people through all the various tools that we've developed through the online courses and the toolkit, design kit, and others. So to sort of talk about human-centered design, which I've now said many times and not told you what it is, human-centered design is really about finding innovation at the intersection of these three lenses. So the first and most important is what is it that people want and need? So what's desirable to people? Oftentimes, people start their new companies or organizations with sort of the primary focus being on what's going to make them money, what's the business viability. And though we believe that that's a really important lens to layer on, we really believe that it's most important to start with what people want and need. It is important, though, that the things that we develop are sustainable and have business models behind them. And so sometimes those are supported by philanthropy, and other times they're supported by market-based approaches, and many times it's a combination of the two. But that's sort of where the business viability comes in and understanding there. And the third is technical feasibility. So we need to make sure, for instance, that if we're designing a mobile app, that it's built on a platform that people have access to, that we're not sort of assuming that everyone in rural India has iPhones and building our apps on that. So we always are trying to find the intersection of these three circles, and that's really where great innovation lies. So in order to know what's desirable and get into that first circle, we seek inspiration in many different ways. So these are kind of the tools of design. So the first is in-context observations. It's really important for us to go to the field, to talk with people, to ask them lots of questions, to actually do interviews in their homes rather than do focus groups in conference rooms or classrooms. And so here we were doing work on clean cook stoves in Tanzania, and are actually showing women different images of different things that they might want to buy for their families, and asking them to rank these different things so that we have an understanding of, if they had some extra money, would they buy another cow? Would they buy a cell phone? Would they buy a television? Or would they think about a cook stove? And through that, realized that cook stoves were pretty low on people's lists of priorities, which then presents a pretty big challenge when you're trying to work on the introduction of this new technology. But getting in people with in their homes really helps them feel more comfortable with us, and also just through observations as well as what we're actually hearing in the interview, we can get a lot more understanding of where it is that people are coming from. The next is to understand people's latent needs, and so this is connected, which is that it's of course important to ask, to listen to what people say and to watch what they do, but also it's really important to understand what they think and how they feel as well. And so that's again where just through doing observations and not necessarily doing interviews, we do, oftentimes we'll do homestays and spend time with families and just sort of go with them through their daily routines, or we'll sit at a market with a market vendor or with a toilet operator at the public latrine for hours and just sort of watch what's happening around us. And those observations, which really, this comes from ethnography and anthropology, those observations are oftentimes as valuable as the actual words that people say in the interviews themselves. We believe in the importance of talking with the extreme users, and so one example here is when IDEO was doing work on a line of kitchen utensils for a company called Xylus. They could have talked with housewife in Chicago who was using these utensils to make dinner every night for her family. But instead, they went and did observations and spoke with a professional chef and an 80-year-old man with severe arthritis, and watched 4-year-olds as they made chocolate chip cookies. And it was really through sort of the observations of these very extreme users that they are able to design a line of kitchen utensils that met the needs of everyone in between. Analogous research is another thing that we do, which is that, of course, if we're trying to do a project on healthcare, it's important to understand what's happening today in healthcare. But it's also really important to understand what's happening in financial services or environmental management or anything else. I think this is one of the things that liberal arts education does really well, is that you're exposed to many different topic areas and ways of thinking. So one example here is an IDEO team was working to redesign the operating room in a hospital. And they went to see a NASCAR pit crew and understand how in these moments of intense stress and pressure, that NASCAR pit crew was able to change the tires and change the oil of a car and have the driver safely drive off. And so it's a really similar environment in many ways, what it feels like in the operating room, with everyone playing a different role and needing to have very clear communications. And through that, the observation sort of realized different ways to improve the ways that the team in the OR was actually communicating with one another. So this inspiration really helps designers take new leaps in their thinking. And so I think what's important about design is that it's not actually a linear process. It's much more of sort of an evolving approach to problem solving. It's really about taking that inspiration and the insight that you hear and then using that to take leaps in your intuition that allow you to kind of move forward and come up with new solutions that haven't really been heard of before. So one of my favorite quotes is that Henry Ford said, if I'd asked my customers what they wanted, they would have said that they wanted a faster horse. Right? So people, and instead, he went on to develop the car. So, I think oftentimes when we ask people what they want, their answer to that is very incremental. And in fact, what designers need to be able to do is to think beyond those direct responses and answers that they're hearing, rely on their intuition to take these larger leaps into really new domains. So connecting the dots, or this is a process that we also call synthesis, where we basically take everything that we've heard from all these interviews and all the observations that we've done and the analogous research and the extreme users, and we put them all up on boards with people's photos and post-it notes that represent all the quotes and all the details that we've heard, and then try and make sense of it. Start to try and see patterns across what it is that we've heard that really help us understand, again, what it is that people want and need. As I mentioned earlier, we work in multidisciplinary teams. So, would be very common that on one of our projects we could have someone who had a background in graphic design alongside someone that's a mechanical engineer with someone that has a background in global health. And so we believe that you learn so much from other people's ways of thinking, and so therefore we intentionally put people from various disciplines together on teams because we believe that they come up with more innovative solutions that way. And then designers iterate and experiment in order to learn and evolve their ideas. Rapid prototyping is a major part of what we do. This is a photo from a project that we did in Kenya called Smart Life, where we actually were trying to prototype a water delivery business. And so again, instead of just asking people like, would you want to buy water if it were delivered to your door, in which case they generally will respond yes, we actually hired people, we made uniforms for them in Kenya, we created this brand called Smart Life, and we sent them door to door around basically asking people, you know, do you want to have water delivered to you tomorrow? Like, if so, the cost is this. And then they actually took their money and delivered water to them the next day. So, the act of actually testing out these ideas rather than just sort of hypothesizing about them really helps us get much further. So we also did things like we rented a kiosk there and we put in all of our own products and then left the kiosk open for a few days just to see which products people would buy. And so we would, every few hours we would change the way that the products were displayed and change the signs and change the pricing and see how that affected the sales of different products. So we could start to really understand what was attractive to people and what people were actually willing to pay for. We gather feedback by, in this case, this is someone testing a mobile app that we've developed, and we're sort of watching over his shoulder as he goes about it. But we really work to sort of watch people as they interact with the product or the service or the digital product that we've developed to then help us sort of iterate and improve it based on where he's confused or where it doesn't make sense or where he makes a mistake in going through this mobile app in this case. And so always sort of watching and making sure that this is acting and that people are acting with this solution in the way that we expect them to is really important. We do integrated business modeling. The business model canvas is a really useful tool for us. Hopefully some of you are familiar with it. Definitely recommend it, but it's a great way to really sort of map out different elements of a business and start to think about how you're really delivering value to your customers and how you're going to make the business work financially as well. So we have people in our teams that have MBAs. We do a lot of business modeling as well and actually sort of make sure, try and figure out what's the investment going to be required to start this enterprise, how soon will it be profitable, what's it going to require in terms of being able to serve the needs of the poor at the scale that we're looking to serve. So back to sort of the two ways that IDEO.org has impact. One of them that I mentioned was that we try to transform people and organizations through a set of tools that we've developed. And so again, it sounds like you guys are really familiar with these already, but I just wanted to give you the information about them and for any of you who haven't heard of them. The first is the Human-Centered Design Toolkit. We're actually in the process of coming out with the next edition of this, so that should happen over the next few months. But this is really the first tool that we developed, which is kind of the step-by-step instructions on how to do human-centered design. So there we have many different methods in some cases, and that's really sort of a free PDF, or you can buy the hard copy of the toolkit, but just great resource in terms of what human-centered design is about. We just launched last week Design Kit. Definitely encourage any of you who haven't seen it to check it out. It's full of different videos related to the mindsets about design. There's a great video on introduction to human-centered design, and then videos and more methods and cases on how to actually apply human-centered design in many different contexts. We have a free 7-week open online course that I think registration just opened recently for this as well. So we run this course twice a year with Plus Acumen. It's called Human-Centered Design for Social Innovation, and if you haven't had the chance to take this, definitely recommend going through it at some point. But it basically sort of gives you the opportunity to take a project through from sort of initial framing of the challenge through prototyping and launching that new solution. There's also a component where teams from all over the world are really sharing their solutions with one another and connecting, which makes it a really cool global community. And then Amplify, I've talked with a number of you about this challenge because it sounds like some of you are getting involved, and it sounds like there's great opportunities to do so, which is really awesome. I'm so excited to hear you guys are participating. But this is a program that IDEO.org runs in collaboration with Open IDEO, which is that we're running 10 challenges over 5 years. Our first challenge is how might we make low-income urban areas safer and more empowering for women and girls. Our second challenge is how can we support parents to give the best start in life to their children between the ages of 0 and 5. So it's early childhood development, but really in an integrated way. So it's a combination of looking at how do we provide effective education, healthcare, and nutrition support, along with other kind of emotional support to children in their first 5 years. So one of the challenges with the field of early childhood development has been that it's been really siloed. So you have practitioners that only focus on nutrition, or only focus on health, or only focus on education, and almost no one is really thinking about the intersection between these three things. Or how do we think about supporting children more holistically in their first 5 years? And so what we're really looking for in the second challenge is solutions that take that integrated approach. So we do, through Amplify, we do convenings. I just came back from a convening in Tanzania where we were launching the Early Childhood Development Challenge. We use experts as a way to get us up to speed on what great solutions are happening and where opportunities are for design. That helps us frame the challenge and then do things like the video that we just came out with earlier this week. The challenge is posted on the Open IDEO platform, so that's another resource. There's challenges running on Open IDEO all the time. And we're seeing great numbers of contributions for the first challenge that we had. We saw 580 solutions for that challenge, and ultimately awarded with funding 4 of those nearly 600. So lots of competition, but at the same time I gave a few of you some good insider tips on how to improve your chances on this. So definitely connect on that afterwards. And then the third challenge that we'll be launching in a few months is how might we improve the delivery and quality of services for families displaced by conflict or natural disaster. So it's really on refugee camps and how we sort of improve services in refugee camps. So then to just sort of share a few stories about some of the projects, the design projects that we've been working on. So again, we have at IDEO.org designers and fellows that join us. And we partner with nonprofits that have a presence on the ground. And we help them come up with new solutions that really improve the programs that they're delivering. So this is sort of a tangible product example. Products make up about 25% of the work that we do at IDEO.org, and the other 75% is really services, systems, programs, businesses. But this is a good product example. So in Ethiopia, one of the most common grains is teff. Teff is made to make injera, which is the spongy bread that you eat at Ethiopian restaurants, if any of you have been. Teff is a really tiny, tiny seed. It's more like sand than it is like a kernel of maize. And the way that teff has traditionally been planted is that it's broadcast planted, which means that you pick up a handful and you just toss it out onto your field. But if teff is planted in rows rather than broadcast spread, your yields can increase by up to 50%. So a farmer's income can really significantly increase if teff is planted in rows. But if you can imagine planting one of these tiny seeds, like every inch or 2 inches, like it would be impossible. It would take you days to do that. And so no one does it. And there's currently no low-cost planter options for teff seeds. So basically, in a place like Ethiopia, where this is a grain that's really local to Ethiopia, not something that's grown all over the world, no one is really kind of innovating with or for the Ethiopian farmers. So the Gates Foundation funded us to work with the Agricultural Transformation Agency, which is a government agency in Ethiopia. We started the way that we always start our projects, which is that our team flew to Ethiopia and started meeting with farmers, with agricultural extension officers, with researchers, with engineers, with local fabricators, to really understand like what was the challenge, how are farmers currently thinking about their crops, how is teff grown, like what needs to happen to really be able to design an effective planter. We built many, many prototypes. This was, I don't know, after many iterations. But this is the prototype that we came up with, which has essentially is planting 4 rows of seeds next to 4 rows of fertilizer simultaneously. And so, you know, we brought this planter to Ethiopia on our second trip back to the field, and we're pretty excited about it. Until we literally got stuck in the mud in Ethiopia. So this was actually what a lot of the soil conditions were, which is much tougher than the first image that I showed you. And so we actually went to visit some local fabricators and asked them, like, what do you do? Like, how do you move anything through this clay, muddy soil? And these guys basically took our wheels and said, you know, what we do is we cover the wheels in burlap, and the burlap actually has a texture that sheds the mud really quickly, and so it actually allows you to pull the wheels through this kind of mud. And they're absolutely right, and so that actually helped inform the design of the wheels that we're using today on this planter. So this is the wheels after they were covered, which worked a lot better. And you know, this is an evolved version of the prototype that is now being tested during planting season in many different regions of Ethiopia. So we currently have, we just finished up this project about 2 months ago. We currently have 55 seed planters that are being tested in this planting season by many different Ethiopian farmers. We're looking to see what the yields are in terms of those crops and get feedback from the farmers about how it's been using these planters, so that then we can work to develop the next evolution of the planters and ultimately bring them to a manufacturer to make at scale. This is work that we've been doing in Zambia with Marie Stopes International, funded by the Hewlett Foundation. One of the things that they found is that MSI has been working on reproductive health for decades around the world, and as they talk about things like family planning, the messages have really focused on birth spacing and stopping having children after women have had the number of children that they want to have. So reproductive health in this field has really focused sort of population control, essentially, on limiting the size of families. And what people are finding today is actually that the greatest impact that reproductive health services can have is actually prolonging the first birth that a woman has. So instead of getting pregnant at 15 and drop out of school and be a mother, if women can not have their first child until they're really ready to at 20 or 22 or whatever age it is, that they themselves are in a much better position, that their families are better off, that they will have smaller families, and sort of everything works much better. And so our job was really to figure out how could we reframe reproductive health services to really make them more attractive to adolescent girls and get the message away from family planning and birth spacing for these girls and have really targeted messages and services that would actually get them to start using contraceptives. So one of the other challenges with these health clinics is that they use these really intimidating boxes of contraceptives that they would share with the girls and basically sort of go through one by one and say like, well, the problem with the IUD is this and this and this, and the side effects of birth control are this and this and this. And so the girls would walk out and just be like, well, none of those seem like very good options, so I'm just gonna like continue to have unprotected sex. And so, what we were really trying to do is to get this to be a more fun and playful conversation with the girls. And so again, as I will tell you in every one of these stories, we start by talking with the girls. And in this case, we're sort of having them come together and actually design things with us and just get them kind of talking to their peers and have us kind of listen in on this. One of the things that we tried to do is really sort of capture that spirit of what it meant to be a teenage girl in Zambia, and so I'll show you a quick video that we put together of that. For us, when we were working with MSI and with Hewlett, to sort of get into the space of what it meant to be a teenager again. And again, to sort of get out of this model about thinking about the clinic and thinking about contraceptives, and instead sort of think about what it meant to be a teenager and in love and in a relationship, and really start from that perspective instead. One of the things we were trying to do is figure out, like, how could we start connecting or have conversations with girls? And so our team actually decided to try these pop-up nail salons. And so they basically put up a sign on the sidewalk that said, like, free manicures, over here. And what that allowed us to prototype was actually an interaction where, like, a peer educator could essentially have a conversation with a girl while giving her a manicure. This is a really sort of unintimidating way to approach a sensitive conversation, because you're both sort of looking down at your nails, and the woman could say, in this case, this is one of my colleagues who's talking with a Zambian woman, but could sort of say, like, do you have a boyfriend? Do you have sex? Like, do you want glitter on your nails? do you use a condom? And so it, like, makes it like this really sort of light and easy conversation to have. And this really has been actually, as we moved into the design of this solution, these pop-up nail salons are actually like a really critical way to get girls in and start engaging them in a conversation. So what we ultimately designed was a communications campaign. These are the Divine Divas. Girls in Zambia really resonated with the word diva. It really means to them a strong woman. And so again, instead of focusing on sort of the challenges with each of these different modes of contraception, they really focus on them sort of being different characters. So you have condoms for the every girl, the pill for the perfectionist, and the injection for the girl on the go. And so it really focused on, like, what type of girl are you, and then therefore, like, what type of contraception should you consider. And so we designed brochures on each of these different types of contraception that really focused on the positive benefits of each of them rather than on the downsides of them. This was sort of the sketch, and we ultimately implemented it of, like, what the nail salon would really look like and how this would work. This was sort of the first entry point for girls in terms of even having the first conversation about contraception. We developed the whole brand and design principles and the journey map for MSI about how this new program would play out. We built, you saw the first intimidating box of contraceptives. This was the redesigned one that we made for them, which seemed much more accessible and friendly for the girls. And then we gave them sort of all the materials of what you need to make a pop-up nail salon, what you need in terms of sort of sharing information about the different contraceptives. We redesigned the health clinic to make that actually more attractive and more appealing for girls, so painted the walls and put up curtains and just sort of made it a friendlier, more fun environment. And we trained peer educators to go out into their communities to actually spread the word to girls and get them to come in and visit these different health clinics. And it works. So the girls have been coming. They've actually, it's the first time that MSI has actually seen teenage girls in any of their reproductive health clinics. They've only really ever seen mothers. And so they're seeing girls come in school uniforms at the end of the day, which again, like, they've never seen before, just by sort of reframing how we talk about this issue with girls and taking a much more human-centered approach to it. So we're seeing that we're in early pilot stage on this, but so far we've seen 73% of the girls visiting these newly designed reproductive health clinics are receiving contraceptives. So high rates of those coming in and high numbers of girls actually walking in the doors of the clinics today. This is a project that we did in Chicago with an organization called MoneyThink. So this is one of the domestic examples of our work. MoneyThink is a great organization that has a financial literacy program where they teach financial literacy skills to low-income high school students in the south side of Chicago. And one of the things that they are finding was that the students, loved the program and it was going really well in the classroom, but then they sort of forgot about it after they were in the classroom. And in reality, they were making all of their financial decisions outside of the classroom. And all of the students had smartphones and would be able to sort of practice what they were learning around financial literacy through a well-designed smartphone app. So again, we spent lots of time in the classrooms with the students, with the teachers, trying to understand, their sort of choices and behaviors and what games they loved on their phones and what they needed to learn or have reinforced through a mobile app. We prototyped our team over the weekend, sort of prototyped different ways or directions that it could go using Instagram and other sort of existing platforms to kind of create a photo journal of like all the things that I bought over the weekend or my sort of reflections on spending money over a weekend to really get a sense of what we would want and then start to adapt that to our understanding of these teams as well. We started building prototypes and again, like I mentioned before, sort of look over the shoulders of people as they're using them to understand how it's working. And ultimately developed this challenge platform that allowed the students to really, in teams, take these different challenges to really practice smart financial behavior. So some of them were things like take a photo of everything that you buy for a week and your thoughts or reflections on it. And so then students could really start to know when they felt like something was a worthwhile purchase and when it was just sort of a spontaneous purchase that they kind of regretted 5 minutes later. They could also do things like find something in their house that they could sell on eBay and get permission from their parents and then make a little bit of extra money. So ways of sort of earning income and ways of spending money more effectively. And this app, the MoneyThink app, is now on the Google Play platform and being tested across their programs in Chicago, which they're looking to expand beyond now. So we have, students that are in this program that are piloting the mobile app, and then they're looking to evolve that and then scale it up from there. And then the last project to share is work that we've done in Ghana on creating a venture called the Team Team. This is actually the team, part of the team that is actually running this business in Kumasi, Ghana. So we spent time in Ghana really trying to understand, where are people going to the bathroom now? What do they like about it? What do they wish was different? What are they willing to spend on a toilet? What would they want it to look like and be like? We ultimately designed this service model, which is really an in-home toilet. So you pay a monthly subscription for a toilet to be in your home. The waste is collected from it 2 to 3 times a week by a local operator. It's brought to sort of a central processing facility, and then ultimately that waste is converted into value through fertilizer and ultimately energy. We prototyped many different existing camping toilets and toilets that we sort of hacked together. We flew to Ghana with 6 of these types of toilets, various versions of these types of toilets, and left them in people's homes for a couple days at a time, and then came back to collect them and got people's feedback on what they liked about the toilet, what they hated about it, what they wanted it to, how they wanted it to be different. And that really helped lead us to the design of the toilet itself. We also brought different brands to people to ask them what they thought the toilet should be called. The way we did that was that we came with these different, the photo on the left, we came with these different stickers that had different logos and marks and different names. And when we left them the toilet for the 2 days, we said, which sticker would you like on this toilet? What do you think this toilet should be called? And of the 12 families that we ran this prototype with, 11 of them chose the Clean Team logo and name, and one of them chose something else. So it was a pretty clear indication that that was the one that we should go forward with. And then the photo on the right is just sort of many evolutions and iterations on the Clean Team brand itself. So wanted to really get it right, and worked also with Water and Sanitation for the Urban Core and Unilever to really develop a whole communications campaign and package that would really drive demand for Clean Team rather than us having to rely on these salespeople going door to door and asking people if they wanted to sign up for it. So now these toilets, this is the toilets being delivered in Ghana, being sort of opened and inspected by the kids. This is the toilet actually in the latrine, where normally a latrine would be. And so we now have about 3,500 people in Kumasi with their first toilet, thanks to the Clean Team. And they're looking to scale that to about 10,000 in the next year or so. So I'll stop there and see what questions you guys have.
A question about the seed planter within what you said that would eventually be moved to kind of larger production. Would it be produced in the US or in Ethiopia? And would that eventually become a business for some of the community, or like how would it be sustained?
Yeah, great question. So the idea is to produce as much as possible in Ethiopia. Ethiopia does not have very robust manufacturing capabilities, however. So the frame itself, which is metal, can easily be produced in Ethiopia. But the plastic parts that really are the metering device, which is the really precise bit in the middle that sort of measures out the tough seeds, and the fertilizer, that there's not currently anyone in Ethiopia that has the capability to manufacture that. So the plan is that piece of it will be manufactured in China until we all hope that African manufacturing capabilities will improve dramatically in the next decade, but until that happens, it's not possible. The assembly can happen, I think, at a really local level, like at a community level, but I think there's not even really like metal fabricators that can work at scale anywhere outside of the capital at this point in Ethiopia. So, we always, whenever we're designing products, like the toilets that I showed you for Ghana, those were manufactured in South Africa. That was sort of the closest plastics manufacturer that could make that toilet. That was the closest to Ghana that we could find. We're trying to find a manufacturer now in Nigeria, which is, again, closer to Ghana. But always trying to find sort of the closest manufacturer to the local context where we're designing, but especially when we're working in Africa, that can be a real challenge. Yeah.
Recognizing that everything is connected to everything else, you said in the beginning and in all the examples that you have that the focus of IDEO is really on poverty and those kinds of underserved communities in a social setting. Is there any desire within IDEO.org to expand that sphere to, say, areas like environmental issues, or are you very explicitly going to keep the boundary around poverty and let those problems be dealt with by somebody else?
Yeah, so one thing to note is that IDEO, the for-profit, so IDEO.org is about 30 people, we're 3 years old. IDEO, the for-profit, is 600 people, 35 years old. So IDEO continues to do a lot of social sector work and a lot of social impact work that's outside the space of poverty alleviation. So IDEO, for instance, has a team of people that work on the environment and climate change. They have a group of people that are working on education. They have people that work on the arts. So the idea is basically that IDEO.org's mandate will likely remain on poverty, but that IDEO will continue to work on challenges related to, they do a lot of work on like democracy and governance and many other social issues that are sort of outside of the realm of poverty. Yeah.
Thank you for sharing these. It's really inspiring to see seeing projects in specific areas and you taking that situated knowledge. And I'm curious, how is that these projects, if they can be replicated to maybe regional areas or duplicate companies in certain regions as well?
Yeah, so One of our mandates with IDEO.org is really to share the work that we're doing pretty broadly. And so on our website, we actually share the projects that we're doing and share those deliverables as much as we're able to share. With the idea really being that we want both the process and methodology to spread, but also the solutions to spread. So for instance, with the work that we're doing on reproductive health in Zambia, we now have funding to actually take that work to likely Tanzania and really understand, how does this model need to evolve for Tanzania, and then start to develop some principles of how it could expand from there again into other countries. And so we hope we're sharing sort of this work with the global reproductive health community, as well as sort of working with MSI to move it into all of their other country offices. So that's really what we want to do, is to really be able to share those insights and learnings and solutions. We also do work, we've been working on a lot of financial inclusion products, and there we've actually been sort of taking a view across all of our projects and understanding some different themes and insights between, youth in Chicago and post-hurricane survivors in the Philippines and people in urban Nigeria around financial inclusion and financial services, and then start to sort of be able to draw some patterns there that we then share with the sector. So it's definitely part of what we do is sort of that sharing, not just of the process of human-centered design, but of the content of the work that we're doing as well. Yeah.
First of all, thank you. It's been really enlightening. And I really especially like the Divine Diva example, because a lot of these tend to be product-centered. The deliverables are essentially products, and I'm interested in hearing your thoughts about how this translates to behavior change that might not be centered around the product, but more about an approach. And so, what do you think about the transferability of that?
Yeah, I think it definitely relates. We did work a few years ago in Peru, actually, on increasing voter participation and citizen engagement. And so there we were sort of applying the same process of human-centered design. In Peru, voting is mandatory, but what actually happens is that people aren't necessarily informed voters. They just go to the polls and either submit blank ballots or just sort of vote based on, totally randomly. They really don't believe that their politicians are going to follow through on any of the promises that they make. And there's just a lot of disillusionment with the political system in Peru. And so there, our work was really about sort of developing campaigns and mechanisms and tools for citizens to hold politicians accountable, to actually deliver on those promises, to develop sort of feedback mechanisms for citizens to be able to share their concerns with politicians, for people to really feel like they could kind of speak up and say, like, this thing's broken, or like, I want this to be fixed, and to really make them feel like they were a bit more empowered and had more of a voice within their communities. So I think, it can really, human-centered design can apply to any kind of challenge from that sort of level, yeah.
Did you end up changing policy then? Was it about policy?
We were working with community-based organizations that were then working with political organizations and with municipal governments. So we were working with 2 different departments in the government and 2 major community-based organizations. So we weren't changing policy. We were working to basically enable those different ministries to be able to allow for feedback mechanisms for the politicians to hear those voices. So the politicians, ultimately the politicians still didn't have to, right? They could have chosen not to, but ultimately the idea was that if people were voting for their politicians based on their politicians delivering on these promises, then those politicians that didn't follow this would be less likely to be reelected in the future.
Communication mechanism.
Exactly.
Great, thank you.
Yeah.
Thank you. So I have 2 questions. I'm wondering, you were talking a lot about the human design toolkit and the design kit. I wanted to know more about your vision for these sort of open source resources. And then I'm also curious about, in choosing partners, if you have certain criteria for those partnerships.
Yeah, great. So, yeah, I think what we're looking at doing now is we feel like we've done a pretty good job of providing people with sort of the introductory human-centered design toolkit and methodology and courses. And we really want to sort of move on to the next level, which is like, what's the intermediate level of courses? So our next move is actually, well, we're doing the next HCD toolkit, so the actual manual we'll develop now that we have design kit out. And then we're developing a set of intermediate level courses with Plus Acumen. So there'll likely be a course that dives more deeply into design research, one that's on synthesis and one that's on prototyping. And then working with IDEO, I think at some point, there's a lot of talk around certification and whether we could actually certify people in human-centered design through these online offerings. In terms of partner selection, we look for a few things. So first, they have to be working with low-income communities and focused on poverty alleviation. Another is that it's really important for us that they'll allow us to share the work that we do with them. They need to be a mission-driven organization, so it could be a for-profit or a non-profit, but ultimately that impact is really what needs to drive them and the challenge that we're working on together. And then finally, we look for partners who we believe can implement. And so we need to see that they have resources that they can bring to the program. We need to see that they have teams that know how to launch new programs or know how to bring things to market. So really important that they actually have the implementation capabilities. Yeah.
So as you were saying, different industries can influence and inform each other, like NASCAR and hospitals. How would you say what IDEO is doing and what human-centered design is doing can inform people that are in roles not surrounded around design, whether that's analysis, research, customer service, sales, whatever it is? What do you think are the big lessons to learn there, no matter what you're doing?
Yeah. I mean, I think the biggest one is just to talk to people, right? So like, you know, the guy that leads, who does finance for IDEO.org, instead of just sort of like defining a new expense policy, he applies a human-centered design approach in his job and like talks to people in our organization about what their challenges are with submitting their expenses for reimbursement, right? And starts with sort of their perspective and experience and then designs a system of expense processing based on people's experiences and based on those conversations with them, right? So whether you're in finance or whether you're in, you know, working with strategy consulting or marketing or whatever it is, I think the most important thing that human-centered design teaches you is to be human-centered, right? So to start with talking to people rather than start from your own perceptions of what the solution is. And then I think the second major thing that human-centered design teaches is around prototyping. So again, let's say you work in a marketing function, you know, test out different marketing campaigns and show them to people when they're really rough sketches rather than like waiting to spend, you know, hundreds of millions of dollars on like a big ad buy, you know. And so I think just developing really rough, rapid prototypes early on is another thing that human-centered design can teach really any industry.
Cool, thank you.
Yeah.
Thank you so much for sharing all the stories. One thing that I thought about was is if whether or not IDEO.org or IDEO ran into a situation where design wasn't enough, and what kind of bridges the gap, and what can supplement human-centered design, I guess.
Yeah. It's a good question. I get this question a lot and I always sort of grapple with it. But, you know, I think the human-centered design is tough when it's applied to policy if it's not directly working with policy people, right? So I think that oftentimes human-centered design solutions can be really focused on the people, which is great, and on our communities. But for it to really influence policy, it needs to be sort of thought of at more of a systems level. And so the initial tool set and sort of the introductory way of thinking about human-centered design doesn't adequately think about large-scale systems as well as it needs to be able to influence policy. That said, I think when we have, you know, our more experienced professionals who've done this work for decades do have a stronger understanding of systems, especially as we bring in people that come from backgrounds in education or public health, they do have those systems understanding, and then they're able to apply human-centered design to things like policy. But when we just sort of take people that have more generalist backgrounds or people that don't have as much experience, it's really hard for them to be able to understand the complexity of how to apply these solutions that are really targeted based on individual people's needs to integrating them into these large-scale global systems. All right, well, we are at 1:30, so I'm going to wrap it up here, and thank you all for coming on this beautiful Friday afternoon.